Am revenit în direct. Parteneriat în premieră pentru stomatologia din România. Creatorul implantologiei moderne, profesorul Paulo Malo, va colabora cu o clinică din România, fiind mentor al echipei de medici și chirurgi implantologi în cazuri complexe de reabilitare orală. Vă propun în cele ce urmează să urmărim împreună un interviu oferit în exclusivitate postului B1 TV de către profesorul Paulo Malo. Eu vă mulțumesc pentru atenție. Ne revedem la ora 15.
Inovațiile în domeniul implantologiei moderne oferă pacienților cu afecțiuni dentare complexe o soluție de tratament rapidă, funcțională și care are o rată de succes de 100%. Se întâmplă astăzi în țara noastră printr-un parteneriat istoric pentru stomatologia din România. Renumitul profesor Paulo Malo, fondatorul implantologiei moderne mondiale, colaborează cu cel mai mare grup de clinici stomatologice din România. Prin acest parteneriat, pacienții diagnosticați cu severe atrofii osoase sau cărora li s-a oferit ca alternativă pe viață purtarea unei proteze dentare, mobile sau intervenții succesive îndelungate, au șansa de a-și recăpăta zâmbetul și calitatea vieții în doar 24 de ore, fără a avea o experiență traumatizantă și având siguranța unui act medical de înaltă calitate. În cadrul unui interviu, profesorul Paulo Malo ne-a vorbit despre protocolul care îi poartă numele, protocolul Malo, despre conceptul All-on-4, despre implanturile Nobel Speedy, despre puntea dentară Malo Bridge și alte tehnici revoluționare patentate de profesorul Malo, de care medicii implantologi din întreaga lume se folosesc pentru a trata cele mai complexe cazuri de edentație totală. Profesorul Paulo Malo este creatorul Malo Protocol, tehnici și sisteme chirurgicale care au schimbat paradigma în implantologie, printre care conceptul All-on-4, ce permite inserarea sistemului de 4 implanturi într-o singură zi pentru pacienții complete dentați, fără a fi necesară adiția osoasă.
I am the one that invented this system that allows people to have teeth in one day without the need of bone grafting. So this is very important because not only some patients cannot do the bone graft, so the patients that could not do the bone graft, they cannot have fixed teeth. But also the patients that can do the bone graft, but it costs more money. In fact, if we do my technique, not only you can have teeth in only one day, but the price is almost half. And the success rate is higher and the aesthetic outcome is higher. So normally, when you want more success or better quality, normally you pay more. This technique, actually you pay less for the reason that you do not need bone graft. And of course that money is reduced from the total treatment. So this is a very important technique, and it became today one of the most important techniques around the world. In the Malo protocol, the immediate results for the patient is that the patient within 2 or 3 hours can walk out with fixed teeth. Teeth that look like normal, natural dentition, they feel like natural dentition, and you can work with these teeth like you work with your own natural dentition. Imagine somebody that does not have teeth and has a denture, a full prosthesis, or somebody that has teeth but they look very ugly and moving. In 2-3 hours, you walk out with fixed teeth like natural teeth. So this is really something very, very special. We consider a complex case every case that has to do a bone graft or cannot be done. What does that mean? Normally, this means that the patient does not have teeth for a long time. And if you do not have teeth for a long time, the bone disappears. So it becomes a complex case. So this is one category of complex cases. The other is age. If you are 90 years old, 95 years old, or 85 years old, this is always a complex case because of the age. Bone atrophy is a medical term for not having enough bone in the mouth, in the jaws. So when you remove the teeth of a patient, the bone starts to disappear. So every time you remove one tooth, the bone in that place starts to disappear. if you remove all the teeth, the bone starts to disappear, and then you become like that. And this is a complex situation, because without bone we cannot place normal dentures that can hold. The dentures are always falling off. Or we cannot do implants without bone grafting and other situations, which costs a lot of money, takes too long, maybe 1 year to have the teeth, and the success rate in older people is low. My technique, what we developed, and I have developed this for 20 years now. This is not new. This has been 20 years. So what I have developed is specifically for older people or younger people without teeth. Now, this technique is only to be used in people without teeth, no teeth, or with people that the teeth we cannot use anymore because they are in a bad state. So normally young people are not for this type of technique, because young people, they did not have time yet to destroy their mouths. So typically our patient is 55% until 90. The oldest patient I treated was 94. The youngest one was 16 years old. He was born without teeth. It's a syndrome. But the youngest patient, I think, that I treated without this syndrome, without this type of problem, that was born with all the teeth and then lost, I believe was 20 or 21. It was a motorbike accident. He lost all his teeth, and of course when you lose all his teeth, then this is the solution. Yes, there was one boy and one girl that I recently treated. He was 16 and she was also 16 or 17, but they were born without teeth, and this is very, very difficult, because when you're born without teeth, the bone and the jaws, the maxilla, does not develop, so become very small. So this is very, very, very difficult. Difficult cases are always this type of case, and cancer patients that lost part of the mouth, and trauma that also sometimes lost part of the mouth. Without these type of patient, the normal patient, let's say, patients that have some teeth and they're lost, they use dentures, normally it's not such a difficult case.
De-a lungul experienței sale medicale de peste 25 de ani, profesorul Paulo Malo ne-a dezvăluit că cea mai mare nevoie a pacienților diagnosticați cu afecțiuni dentare complexe este aceea a eficientizării timpului de tratament și a costurilor tratamentelor. Pacienții care se pot adresa expertizei profesorului Malo sunt aceia care, din cauza pierderii timpurii a dinților, au resorpții osoase accentuate, soluția reprezentând-o implanturile zigomatice. Implanturile zigomatice își păstrează volumul și densitatea nemodificate, iar prin intermediul acestora se vor evita procedurile de adiție de os și de ridicare a sinusurilor, fapt care duce la două beneficii imediate: un tratament de durată mai scurtă și mult mai confortabil. Pacienții români au probleme dentare complexe, mai de timpuriu decât cei din țările mai dezvoltate. Ultimul studiu realizat de către liderul stomatologiei private din România arată că 4 din 10 locuitori ai orașelor din România au cel puțin un dinte lipsă. Acest lucru este cauzat de o igienă orală deficitară și de lipsa acțiunilor de prevenție sau nerespectarea programului de controale periodice. Toți acești factori duc la pierderea timpurii a dinților, iar statisticile arată că în țara noastră acest lucru se întâmplă mai devreme decât în alte țări cu grad de civilizație ridicat. Astfel, cu ajutorul echipei de medici pe care o coordonează în România, profesorul Malo își dorește ca tehnicile patentate și transmise echipei sale să ajute cât mai mulți pacienți ce reprezintă cazuri complexe. Astfel, pacienții români cu afecțiuni dentare complexe vor avea acces la un protocol de intervenție inovator cu rezultate imediate, fără a mai fi nevoit să plece la tratament în alte țări.
The main benefit of the patient is to have all the teeth fixed in some hours, one day. The second benefit of the patient is that he pays much less, because you do not need to do a bone graft. And the third benefit of the patient is the success rate. Success rate of this technique is 98%, so it's very, very high. It means that the patients that lost all the bone, and they go to their dentist and say, okay, We can have implants to have fixed teeth, but you need to do a bone graft. Now, two things happened. If the patient is older age, like say 80, 85 years old, 80, 90, it's not really good to do a bone graft. If the patient has sinus infections, it's not good to have a bone graft. If the patient has some disease, like for instance heart problems, diabetics, it's not good to have a bone graft. And the second reason is expensive. These procedures are always expensive procedures because it takes a lot of products, it takes a full team qualified. So these procedures are not possible to do with 10 euros or 50 euros. It's not possible. But with this technique, now more people can afford, because now we are not talking about 20,000 euros and 15,000 euros. We are talking about 7,000 to 10,000 euros, which is literally half. And each country has their own prices, because each country has their own rent prices, and the staff costs, salaries are also different. But a treatment like this, for instance, in Japan is 30,000 euros. But in Romania is less than 10,000 euros. I work with Noble Biocare for now almost 30 years. And I developed many products for Noble Biocare, and I developed many techniques. In fact, I developed them for Noble Biocare, but today every company in the world copies this. So the techniques and the products. So basically, when we do not have teeth in the mouth, or we have very little teeth, or the teeth that we have we cannot use, there is two types of techniques we can use. One is the all-on-4. This technique I developed. And the other one is a combination of all-on-4 with zygomatic implants. Now let me explain this so people understand. An implant is a little screw made of titanium. And the screw can be 7 millimeters in height until 50 millimeters in height. So different sizes. If we can place the screws in the maxilla or the mandibular, normally we use not more than 18 millimeters. But if we do not have bone, then we can place longer implants, can be 50 millimeters, that go and place the screw in this bone here next to the eyes. Now this long screw is called a zygomatic screw, and this is used when we have no bone. So basically, if we have some bone, we can do normal implants. If then the bone disappears, we do something which I developed called all-on-4. And if the bone disappears more, then we do something else called zygoma. Romania is a country that is developing very fast, and is a big population. And I was not with my technique in this country, although some dentists in this country already learned with me in other when I give courses in other countries, but we did not have a malo clinic, a malo dental clinic in Romania. So I was invited by some investors to come to Romania to be able to make these specialist centers for people that want a little bit more, people that want a little bit more aesthetics, and people that have these complex cases, these difficult cases, and they have dentures, and the dentist said we cannot do anything. So this is our technique. So it is obvious that we want to be in every country. We are not in every country, but we are already in 20 countries in the world. The most important countries we already there. And Romania we started this year.
Ca și în alte domenii medicale, și în ramura stomatologiei, cercetarea reprezintă o piatră de temelie pentru inovație. De altfel, o realitate pe care profesorul Malo o consideră elementară dacă ești dedicat meseriei. Influența pe care acesta a adus-o medicinei dentare de la nivel mondial este una revoluționară, numele Malo fiind un etalon al excelenței în stomatologia modernă. Prin această colaborare unică, pacienții români vor putea beneficia de o soluție de tratament imediată pentru a redobândi funcționalitatea și estetica zâmbetului, două lucruri esențiale pentru îmbunătățirea calității vieții.
Reconstruction of the mouth normally passes through implants. It is not really possible not to use implants today in dentistry. Today we need implants for many situations, and remember that some years ago there was a lot of cases that we could not do. We did not have the products, we did not have the techniques. But even today, there are cases we cannot do, even today. So we need to research all the time, and we have a big research department. Like maybe next year we'll come up with also something very important, because we know what we cannot do, and we know what we do, but the success rate is not so high. So it's a constant research to find solutions for the things that we cannot do and find better solutions for the things we already do. So this is never ending, it's always continuous. Dentistry has changed completely. Today we can do aesthetic treatments that really are incredible, almost unbelievable in terms of quality and results. And today I would say that in the last 15 years the most important things we have done was not so much on the aesthetics, but was on this area where people did not have bone, did not have teeth, and today in 2-3 hours you can walk out, you can eat an apple. This was really amazing. This is a major breakthrough. This was absolutely revolutionary. This is absolutely something that is a mark in the dentistry. In the old days, implants have more than 40 years old now, 40 years. An implant is a screw, as I explained. This screw we place in the bone. And then we take a tooth and we screw the tooth or we glue the tooth to this implant. But before we do this, we need to wait 3 to 6 months. So we used to place the screw, then send the patient home without the tooth. Just a screw, meaning the false root. And then after 3 months or 5 or 6, the patient would come back and then we put the tooth. In the meantime, people with that walk around without a tooth or with the dentures. So what I have developed, and this was back in 1991 already, I developed something called immediate load or immediate function. This means that we put the little screw, which is a false root, and immediately after 5 minutes we put the tooth. So this is also a big revolution. In fact, the all-on-4, this technique that we are talking about that help people without teeth, is based on immediate load, because normally you have to place the screws, the implants, and then wait 6 months before you actually place the bridge, the prosthesis, meaning the teeth. But now we do everything within 2-3 hours. So they go together. It's one developed after the other. In terms of safety, is the same. Is 100% safe. In terms of success rate, is higher. 40 years ago or 50 years ago, we were talking about maybe 70% success rate, 75% success rate. Now we are talking about 98% success rate. So today, implantology is absolutely safe, 100% safe. But in terms of success rate, we are talking about 98% success rate, meaning the success rate is higher than eye surgery, hip transplant, heart surgery. You know, all these things are less success than dental implants today.
Prin colaborarea din România a profesorului Paulo Malo se reconfirmă faptul că medicina dentară din România este într-o continuă dezvoltare, că există potențial și că pacientul român poate accesa tratamente stomatologice de talie mondială chiar în țara noastră. Este un moment istoric care pune România pe harta stomatologiei mondiale.
mi-ai salvat viața.